Dr. Jerisa ER coming to you today with your tips for the ER trip. I am your board certified emergency medicine physician. I help confused, anxious, stressed out patients in emergent conditions get back to baseline again. What I wanted to do today is come on and talk to you about this cough thing, this bronchitis. We're seeing a lot of bronchitis in the emergency room. In addition to the flu, we're seeing so much bronchitis. And so I wanted to come on and give you a couple tips about bronchitis and when you're kind of having that headache because you're coughing so much and you can't sleep at night. So when it comes to bronchitis, one thing that I really want to say, one tip that I want to share with you is that a lot of times it is viral, which means that oftentimes antibiotics will not work. Bronchitis so often, 50% of the time, is considered to be viral. You can take all the antibiotics you want, but unfortunately, something that's viral, even like the flu, it has to run its course. There's nothing that you can really do that's gonna make it go away faster. The other thing I wanna really share with you when it comes to bronchitis is that it can last for a long time. It can actually last for several weeks or a couple of months. I myself had bronchitis for 2 to 3 months. I had this dry, hacky cough for several months. So I wanted to at least come on and share with you that don't be alarmed, don't be concerned too much when you have this cough that is really irritating you. Now, with the emergency room, we certainly can give you prescription grade cough medicine that can help you certainly, sleep at night and be able to deal with the cough. But essentially, the cough is really just going to have to run its course. Now, sometimes if the cough is really harsh, there's medication that we can give you like steroids, low-dose steroids or prednisone that can help decrease the inflammation that you're having because you're having bronchitis, which, the itis in bronchitis is inflammation. So it means that you're having excess inflammation around your bronchioles, which is the narrow airway, your narrow aspect of your lungs, not deep in your lungs, but the narrow aspect of your lungs. You still have inflammation, which is the itis. Sometimes you can even hear a wheeze. So if you hear like a little, kind of a faint whisper or kind of a high-pitched whisper, that's considered a wheeze. And when you do that, when we hear that on exam, oftentimes we may give you prednisone or low-dose steroids, especially if you have a smoking history or you have asthma, you will definitely benefit from medication like prednisone. So keep that in mind that 50% of the time, bronchitis usually is viral. And, I really hate to tell some patients sometimes, but when they have had this cough for several weeks, unfortunately, that's part of it. And you may still have a cough for several more weeks. And then one day it just goes away. So rest assured that there is treatment for it. A lot of times the treatment is time, but you can deal with it. And certainly if the cough is too much, you're not really getting enough rest, definitely seek medical attention. And we can give you some prescription grade cough medicine. So those are a couple that I wanted to share with you because we are seeing a lot of bronchitis right now, even after the flu season or even during the flu season. We're still seeing a lot of bronchitis that's going along with it. So that's all I wanted to get on today and share with you. Hope everyone's having a great, fantastic day. I am Dr. Jerisa ER. Of course, you can follow me on social media. All the social media, I am there. If you have not grabbed or even downloaded the free audiobook, Tips for Your ER Trip, you want to do that.